opportunity for all of us to galvanize national momentum towards reducing maternal, newborn, and child mortality in Sierra Leone. This year's theme also resonates with the person-centered life stages approach, which is similar to how mothers and child's health at the start of life set the foundation for a thriving, prosperous future. A healthy beginning is not just about survival. It is about ensuring every child has the best possible start in life and every mother experiences the joy of safe motherhood. With support from WHO and other partners, government recognizes that the person-centered life stages approach from birth to old age is a vehicle for delivering universal health coverage. But this cannot be a reality unless primary healthcare structures for delivering quality person-centered approaches have been strengthened. That will further decrease maternal and child mortalities in Sierra Leone. It is important to note that the person-centered life stage approach is already operational in the Moyamba district, and preparations are made for us to roll this out countrywide. Maternal and newborn health is a moral and social imperative. In Sierra Leone, many women and newborns continue to die from preventable causes, underscoring the urgent and critical nature of this issue. Today, I reaffirm the government's unwavering commitment to ending preventable deaths of mothers and children. Now, drum roll. The recent global mortality estimates indicate that Sierra Leone has reduced from 443 to 354 from 2020 to 2023. So the 2024 figures have not even come in yet, and we've made this much progress. This is an indication that we are on the right trajectory of reducing maternal mortality to less than 300 by 2025. This progress should instill confidence in our collective efforts. Sierra Leone had also seen a decline in child deaths from 220 per 1,000 live births in 2021 to 105 per 100,000 in 2021. These achievements so far result from the government's commitment and measures, among them a robust, structured response through the Incident Management System, IMS, for maternal and child mortality. With the support of WHO and partners, we have established a national IMS Situation Room at the Reproductive and Child Health Directorate, where the story of every single death is told, and timely actions are taken to prevent the recurrence of similar incidents. This demonstrates steps taken forward in instituting accountability to the women and children of Sierra Leone. For this reason, we're putting a mechanism in place to track every pregnancy using Press Track, which is a transformational step forward. You all know about Press Track, the Kumbra app. Every country in the continent wants that product to be shared with them. But we developed it here in Sierra Leone, and it's going to be deployed nationwide. But despite these efforts, Sierra Leone still has a very, very high maternal mortality rate. And we should redouble our efforts so that we are able to attain the SDG 3.1 by reducing maternal mortality to fewer than 70 per 100,000 live births by 2030. Neonatal mortality stands at 31 per 1,000 live births. with 24 stillbirths per 1,000 total births, and under 5 mortality remains high at 105 per 1,000 live births. In this regard, the Ministry of Health declared maternal mortality rate an emergency in the country to allow for more focus and resource allocation locally and internationally to reduce the burden. Informed by our history of Ebola, the government, in collaboration with WHO and other partners, have also strengthened our health security by establishing the National Public Health Agency tasked with coordination of public health emergencies, preparing the country to handle every epidemic and pandemic situations, and to protect the future of our population. This has enabled the government to respond to epidemics and pandemics in record time. For instance, the government responded to a polio outbreak in 2024 and managed to control it in record time by vaccinating children, saving lives, and giving the children, their parents, and the entire community a hopeful future. Thanks to WHO, to UNICEF, and all of our other partners. The government commits to continuing to support the work of WHO and that of our partners to deliver health services to the population despite the reduced fiscal space. The government also commits to mobilizing additional domestic resources, including from the private sector, to support the delivery of quality health services and fulfill the member states' commitment to WHO while putting people at the center of services. I call on all stakeholders, from health professionals to community leaders, the community, the members of the press, to continue leveraging our achievements and building on them to respond to the public health needs of our populations, knowing that the country has the full support of WHO and all of our partners. Together, we can build a Sierra Leone where no woman dies giving life and no child dies before their potential is realized. Let us work hand in hand with the government, partners, communities, and health workers to give our mothers and babies the healthy beginnings they deserve and the hopeful futures we all envision. On that note, it gives me great pleasure to launch World Health Day in Sierra Leone.